Hello, I'm Melanie Hoffman, and I'm a counselor at Village Health Partners. I'm passionate about helping clients maintain quality of life and developing skills that will serve them long after their counseling sessions have ended. I have been a counselor for approximately 11 years and developed a passion for helping people because of lifelong encounters where people would tell me they felt better after sharing difficult experiences in their lives and felt comfortable and safe sharing those moments. June is Post-Traumatic Stress Disorder Awareness Month. Many who suffer from PTSD don't always receive the help they need. It's important to know that PTSD isn't only a mental health disorder that affects military veterans. It's something that anyone can experience who has gone through events themselves, witnessed a traumatic event, or was told about an event in a way that can feel as if it happened or could happen to them. It's also important to know that PTSD may not be a response to a single event, but can be an accumulation of many traumatic, recurring events, such as chronic sexual or psychological abuse. Symptoms can take months or even years to appear. Symptoms of PTSD can show up in different experiences, such as nightmares, intrusive recurring daytime memories of an event, flashbacks, where you feel as if the event is happening again and act as if it is happening again, negative responses to triggers that are associated with the event or memory, and withdrawing and avoiding people and places that are connected with that memory of the experience. It is also not unusual for people to turn to substance abuse as a coping mechanism to deal with those intrusive memories and emotions that are so difficult to cope with. My training as a certified clinical trauma professional provided the foundation of how I lead clients who are dealing with PTSD through a series of steps that begins with learning how to achieve and maintain physical relaxation, and then leading them through a series of steps where they eventually are able to recall details of the traumatic experience with a relaxed physical body and absence of intense negative emotions. It is important to stress that this recall is always done when the person is ready to take that step and never rushed. There are other effective methods of healing from traumatic events, such as EMDR, eye movement desensitization and reprocessing, and hand tapping, that when used with a trained professional is likely to have very positive results. If you or someone you know is experiencing possible signs of PTSD, please don't delay in getting professional help that can restore quality of life, that leads to positive relationships and the ability to achieve those personal goals that are so very important to living a life with meaning and hope. Thank you.